Hey, this is Matthew on the SWYP 7-Minute Supersonic podcast. I'm here with David Becker from Orascoptic. Welcome.
Thank you, Matt.
Aloha, as they say.
Aloha.
Which I think means hello, goodbye. It means many
it's not
things.
going to snow ever.
Yeah, it's wonderful.
Beautiful. Paradise.
So let's talk about high-quality dentistry. There's lots of ways you can achieve high-quality dentistry. You got to have the right equipment. Clearly, you got to be trained. You got to know what you're doing.
I agree.
Tell me how loops fit into that, because it seems like vision is important in dentistry.
Right. Yeah,
So,
I always hear that your eyes and your hands are one of the most important things.
yeah, so you
in
need
dentistry,
hands
so.
and you need eyes, but you don't. Right now, there's no robotics, that we can do, but we
Right.
can. There are things we can do to give us better vision. So let's talk about that.
When people are wearing loops, a lot of times it's to see better, obviously. It also helps them sit better. It's going to help their
Does it?
ergonomics.
Posture.
So you have posture. You have them all customized for you. And a lot of dentistry is microscopic.
Right.
So to be able to look into a patient's mouth and see something that's 3 times, 4 times, even 5 times the size
Right.
of what you would see with the naked eye, you're going to be seeing a lot of different things that you wouldn't normally see without that
Right. What
magnification.
percentage of dentists use loops now? Any idea?
If I had to guess,
20 or 30?
I mean, using loops, I would say it's probably closer to 80.
You think it's that high?
I think it is, yeah. I mean, and I think that everybody understands that loops is necessary.
They've accepted it.
It's a part of the job.
It's accepted treatment of care. Is I'm gonna have
Now
it.
I'm more consulting people on what would be best for them. Like what power do they need, or what, there's a lot of different brands out there. So
Sure.
why they might want to go with Orascoptic over another company.
So and I'm guessing that once somebody uses a loop, they're never go. I would guess 100% of the people who use a loop
100%,
never go back to not using a loop.
That's
because
true. And so the objection I do get from people if they're not using loops would be, I don't want to become reliant on something.
Right.
But I ask, are you reliant on your handpiece?
Right.
There's using loops is something that it's helpful.
Sure.
And it's kind of necessary to do the job.
That's like not getting glasses because you don't want to be reliant on glasses.
I'm a territory, and everybody that uses loops tells me that if you're not using loops, you're just kind of doing a disservice.
Yeah.
For
So,
your patient.
I mean, eventually everybody comes on board, and obviously younger, are they teaching this in dental school? Are they using loops in dental school?
They do. There are schools that mandate it.
So once you learn a loop, then you can't imagine.
Right.
Not.
There's other schools that they don't require loops, so the
Right.
students are allowed to get them if they want or if they don't want. So it's one of those things that's right now in transition, but
Sure.
it seems like a lot of the schools are now moving towards mandatory use.
So 10 years ago, loops were like heavy and ugly, right? It was like you're going to war. You had this thing on your head and your neck got tired.
Right.
They've gotten a lot lighter and they've gotten smaller and they've gotten better. So tell me why this is the best. This is the Spark and the...
So this is what you're looking at here is a combination of the Spark wireless headlight and the EyeZoom variable magnification telescope. These are 2 different products. So first I'll tell you a little bit about the Spark.
Yeah.
So this is a wireless headlight that you turn on and off by touching the edge of the battery.
Right.
It is removable, so that doesn't have to be on this particular setup.
So if you don't want a light, you don't have to have a light. If you've got the overhead light or you do a different setup or whatever, you don't need it.
You don't, but I will tell you that there's a lot of people who use loops and a light, and they will say, I would rather be without my loops than be without my light.
Right.
My personal hygienist uses the Spark headlight only, doesn't use an overhead.
Okay.
So she just goes to work, taps it on, taps it off. It's a better patient experience because as a patient, I'm not having a big, bright, hot light. It's just the loop light in my
Why
mouth.
light the room when you just can light the mouth?
Exactly.
Right? Yeah.
Exactly 100% of people that use headlighting hate the cord.
I think it's 1,000%.
Surprisingly,
actually. Yeah.
right. So without having to deal with that cord all the time, catching it on things, the Spark headlight allows you to be completely wireless and then just go about your business while you're working in the mouth.
And so let's talk about the what's the...
So the EyeZoom is the telescope.
Okay.
This is a telescope that could be mounted onto any frame.
Right.
This is currently on our Tempo frame. ultra lightweight aluminum frame.
Right.
But specifically the EyeZoom, so what happens is people buy magnification. Typically they'll start at 2.5, maybe 3 power, because that's going to give you a nice wide field of view.
Right.
And it's an easy loop to get used to using. After a number of years, people kind of want to see a little more, a little bigger.
Get comfortable with it. You're like, all right, I'm ready for a little more.
Right.
Let's go deeper.
So they buy another pair of loops, and then they get used to that, and then they buy another pair of loops.
Right.
Other side of that is some people want a 2.5 because they're working in just a general area, and then they have a second set of loops for when they're doing endo, or something that's more specific. With the EyeZoom, they're able to grow with it. They can start on the 3 and leave it on that for a year or two, then go to 4, then go to 5.
Oh, so you can adjust the magnification.
Correct.
Got it.
Or you can use it in your day-to-day procedure to procedure, 3, 4, 5, 4, 3, whatever you need. A great part of having this is you're not always handicapped to having a 5 power. A 5 power is going to be very close, very restricted field of view. So you can back off to 3 if you need to.
Who uses this? Is this for everybody? I mean, is this just for GPs, orthodontists?
It is surprisingly, I couldn't tell you that there's one specific specialty. So it's a very high quality telescope. Right. It's a partnership we have with Konica Minolta. So it's like you're looking at a high definition image.
Right.
And because it has that 3 sort of basic low power, it can be used by anybody.
Right. How does someone, I'm guessing this is you're gonna need to demo it. Like somebody needs to try it on and see it. And
right.
How long does a loop last? Does it last forever?
The loop can last forever if you don't drop it.
If you don't drop it.
Hit it.
So it lasts forever.
We have a lifetime warranty on it just because really magnification, a telescope is going to last. It's like a camera lens.
Yeah.
I mean, how long does a camera lens last?
It should last forever.
The frames, typically, if you're gonna, it kind of depends what your specialty is. In dentistry, they tend to last about 5 to 7 years because patients will give you a hug or you might snag it. Right. In the surgical world, a medical doctor, that lasts maybe 20 years because they're getting them put on them by somebody. Right. So it's totally different. But as far as the build of it, it's going to last you.
So what I like about it is, it's obviously high quality and it's modular, so you can kind of grow with it, right? You've got the lenses, and then you've got the telescope, you've got the light if you need it. You can kind of pick and choose what you want to do. Awesome. Well, there you go. That's David from Orascoptic on the SWYP 7-minute Supersonic podcast. Thanks, David.
Yeah. Thanks.
Cheers. Yeah. Aloha.
Aloha.